Hello, this is Tracy Schreier, and I wanted to come to you with another video about my breast cancer journey. I went to see my oncologist this past Wednesday. Today is actually Sunday, April 5th of 2020. So I went on Wednesday, and it was very, very strange just because of the coronavirus going on. So when I got to the office, I had to wait outside until they kind of flagged me to come in, and I went in between the double doors for the lobby, and there was two women nurses with full, it was like a hazmat or something like that, with the masks on and face masks and everything. um, and they took my temperature and asked me quite a few questions. They had actually called me the night before and asked me the same questions to prepare and see how I was feeling, if I may have been around somebody who had had the virus or may have the virus. So I was fine. They checked me in. I had to go to the front counter to let them know I was here for the doctor. And I had to stand, there was tape on the floor, stand like 6 feet away from the counter. So she checked me in, and I went into the waiting area. There was only one other person in there at the time. They called me back. It was not even 5 minutes. I barely had taken my phone out to start looking at it, and they called me back. And so I went back, and the doctor was pretty quick to come in and ask me how I was feeling. Things have been pretty good so far, and wanted to make sure I was still right. Wanted to go on the path of doing the Lupron shots to suppress my ovaries until I could do surgery to remove them. We were originally hoping later this year. I'm really hoping that I could still do that. I know I will be backlog, although we'll be going through the backlog of all the surgeries that had been canceled because it's considered elective, so I will have to wait. Um, but he was going to try to get me on the list so that it wouldn't be like I'm at the bottom of the list when they go to start doing them. So he was going to talk to my gynecologist to get that moving. And I was going to start, I would do the monthly shot. So I was there Wednesday to get my first one. And then in 2 weeks, I am going to start the uh, anastrozole, and that is the hormone blocker that I will be taking for usually 5 to 10 years. So I know a lot of women take tamoxifen, and that's if you have not gone into menopause or you're not close to menopause yet. The anastrozole is if you are close to going through menopause, or you will be, and as a result of this shot for my ovary suppression and getting those out, I will be pushed into menopause. So that's why I'm in that one. So I wasn't sure what to expect. I did put a note on a private Facebook group for people who have gone through breast cancer and asked, what people's experience was. And it ranged a lot between the shot did hurt. Some people had to have a shot on both sides. I asked where they on the body they got the shot. Some people got it in their hip area, some in their, upper butt. I think somebody said their arm. So I had asked the doctor before I went to get the shot, and he had told me it would probably be like in my upper, like the muscle right where my hip and my butt meet, like right in that area. And he said I would only have to have one. He said it depends on the brand as to whether you may have to have two. So that's why some people might have come back with that. Um, and I think that was it. So in 2 weeks, I'll start that pill. And he had said he would see me one more time when I come back for the next shot in a month. But then after that, I would just come in and get the shot and wouldn't necessarily see him unless it was my regular time. I think every 6 months now I'll be seeing him. So he took me to the area where he showed me this is where you'll go to get the shot. And he said, you basically take this piece of paper, you put it in the basket and sit in the waiting room, and they call you back. Well, there was a lot more people in this waiting room. I want to say there was like 6 to 8 people in the waiting room. And the scariest thing for me, and amidst all the coronavirus and everything, is that I was sitting in a waiting room for not only other people that may be getting any kind of shots related to their cancer or treatment after, but also people who are getting ready to go through chemo or go through one of their chemo treatments. So that was a little scary for me, just that realization. And even my doctor had told me when I saw him Wednesday, he said, I'm so glad that we're not taking you down the path of chemo, just because your immune system would be shot and with all this virus thing going on. So we were relieved for that. But it was very real, I guess, sitting there and thinking that I could be somebody who was going to get my chemo in the midst of all this and just having to deal with chemo in it of itself. So that was a little hard to sit there, and I had to wait a little bit longer, maybe not even 10 minutes, but it felt like forever to me. And then I got called back. As I mentioned, it was just kind of a little syringe, really, not too big, too long, with a needle maybe about this long. And she asked where I wanted it, in the arm or in the back, like between the hip and the butt, like that muscle right in there. And then I started like, well, which one's gonna hurt worse, or does it affect your mobility or whatnot? And she's like, let's just do it in your backside. She's like, because that there's more muscle back there versus, trying to find stuff in your arm. So went back, she just basically pulled down, my sweats a little bit and counted to 3, stuck me. It felt like a normal shot. It didn't feel like anything worse than like a normal shot you might get, like the flu shot or something like that. Then she put a cotton ball and a Band-Aid on it, and I was ready to go. So I wasn't quite sure when I left what if I would have any side effects right away, or if that might take a while. Some women do have them pretty quickly. Some, it takes a while. Some don't even have side effects from it. So the first night came and went, and I woke up in the morning, and my neck and my upper back were aching a little bit. But for me, my upper back has been hurting, not so much my neck, but my upper back has been hurting a little bit more lately. And I think that part of it has to do with, before my double mastectomy, I was significantly larger in my chest area than I am now. And so I think my posture is used to pushing me forward more. And that's why maybe my back is hurting, and I have to practice, the better posture and sitting up straight and like getting my body used to what that is like now. So I attributed that with the neck and the back to kind of that posture stuff. So even though I'm right now 7 weeks out, I still feel like I'm struggling with that piece, and probably will for a while. But then, so that was Thursday morning, kind of how I felt. The rest of Thursday and Friday, Saturday, I was really fine. I woke up this morning, Sunday, and my back was killing me. It was more in my middle of my back, maybe lower, but more like the middle. So it was almost like the pain I had in my neck and stuff had gone down. And it hurt really, really bad. I couldn't even lay down, because right now I'm having to lay on my back. I couldn't even lay down for a while. I sat up in bed for a while. Just because it didn't hurt as much. And then when I came downstairs after I had breakfast, I laid on a heating pad for a while, and that has helped. It doesn't hurt as much now. It does still ache, but not as much. So I did ask a question in the group that I'm part of to see if that was a side effect. And as of this morning, after I posted it, I think within an hour or two, one woman said that she hasn't had any side effects from her shot. So I'm not sure if it's that whole thing with my posture, if I was just achy for some reason when I woke up, or if it is attributed to the shot. I think maybe in the next week or so, if I continue to feel like that, versus kind of like a one-time thing or a two-time thing, that maybe it is because of the shot. I know bone and joint aches can be part of it. So it does feel like in my spine is what hurts. So I'm not quite sure, but that's kind of where I'm at now. So in about 2 weeks, I'll start that anastrozole pill, and then I go back for another shot in just under a month. So I should get a phone call. They were having you leave right after you were done. You didn't even go to the desk to reschedule or schedule for the next appointment. They'll call you and do that because of all the coronavirus stuff. So in just over a month, I'll do my next shot of the Lupron. And then on April 17th, so just under 2 weeks, I go back for a fill at the plastic surgeon. And I believe, I was talking to my husband, I think that this will be probably my last fill. I'm just about to where I want to be. And I think if I get 60, I think it's 60 more cc's, and then I would be at 600 cc's. That will be, I feel like I'm already having some of the production I want, so just a little bit more and I'll be good. And then I'll find out what we do. I don't know if I'll have another appointment after that. I know somebody did measurements before their surgery, but I'm almost wondering if they'll put me on the list to, show that I'm in whatever position I am to be able to do that surgery to exchange the expanders and the implants. And typically, you have to wait after your last fill for at least 4 weeks. Don't think that's going to be a problem because they'll have to get that backlog of all those surgeries up to date once that opens up. But I want to at least get on the, I guess, waiting list for my place in line to be able to have that surgery when I'm able to, or to get that on the schedule. So doing pretty good, other than a little backache, not too bad at all. And trying to keep busy in the house, and got some window blinds. We got a power washer. We cleaned off our deck and some siding out back the other night. Trying to stay busy and preoccupied since we're kind of stuck at home, other than, occasional run to the grocery store now. So I hope you're all doing well. Thank you for watching, and take care.